So just a small background, it's very prevalent, and it's expected to rise as our aging population increases, et cetera. It's been studied and has a huge impact on quality of life, in depression, sleep quality, work productivity, et cetera. It's costly not only to the patient, but on a systems level, and it's not completely benign. It's associated with the risk of falls and hip fractures, et cetera. Urinary incontinence is defined as an involuntary loss or leakage of urine by the International Continence Society. So that's a very broad way of describing it. So when we think about incontinence, we try to stratify what types of incontinence people have. So the two most common types of incontinence usually that are described are stress incontinence, which is a complaint of loss of urine that happens with exertion, sneezing, coughing, other things people may say is I'm laughing, if I bend or I lift something. That's usually stress incontinence. There's urgency incontinence. This is a type of leakage that's accompanied by or immediately preceded by a sensation of urgency, a need to rush or run to the restroom in order to urinate. And then there's mixed incontinence, which might be a mixture of both of these types of leakage. And in this diagram, you can see that often patients that have leakage often have other overactive bladder symptoms. And these are symptoms of frequency, I'm going all the time, or just urgency. I need to rush to the bathroom. I can make it on time, but I have this desperate need to get there. There's other ways of describing it. So I've listed some of the more common things one might describe with their incontinence. There's postural incontinence. I leak when I go from a sitting to standing position. Nocturnal enuresis, which is bedwetting. Overflow incontinence. This might be something that we might see in our men with large prostates, for example. Continuous incontinence. I'm leaking all the time. Insensible incontinence, I'm not sure what makes me leak. I can't really tell you if I cough or if there's an urge. I just know that I leak. Or coital incontinence, that's incontinence that happens with intercourse. And there are other sources of leakage that might occur that it's unclear if it's urine. There can be sweating, there can be vaginal discharge, or there could be fecal incontinence. So sometimes patients aren't entirely aware of what it is that's causing them to be wet, but it might not be urine all the time. So today we'll talk a little bit about voiding physiology. We'll talk about the pathophysiology of incontinence, how to work up the patient, and some in-office treatment options that are available. So this diagram here is trying to be a simplified diagram of how voiding happens. So I'll try to talk through this because I think it's important when we understand how voiding happens so we know how we target it from treatments. So the nervous system is tied very closely into the